Hello. My name is Dr. Karen Sun, and I am the founder of the Integrative Wellness Center in Irvine, California. I am a board-certified internal medicine and integrative holistic medicine provider and have been in private practice for over 25 years. Today's topic is bioidentical hormone therapy. I will discuss the function of sex hormones and the reasons for hormone replacement therapy, the routes of delivery, and breast cancer prevention tips. Have you seen a show in Las Vegas called Menopause? The show jokes about how women gain weight after menopause and lose their sex drive, have hot flashes, don't sleep well and are fatigued, crabby and having fights with their spouse. The show is very funny, but when you go through that yourself it is not funny at all. I had first-hand experience 20 years ago when I went through menopause myself, which motivated me to seek a solution, and that is when I found out about bioidentical hormone therapy. I have been using bioidentical hormones for myself and several thousands of my patients over the years with success. The three main sex hormones for women are estrogen, progesterone and testosterone. The functions of estrogen are as follows. Estrogen maintains the health of cells of the reproductive system, including the breast, ovaries, vagina and uterus. Without estrogen, those tissues become atrophic. It also improves the functions of the cardiovascular system by dilating the blood vessels, reducing blood pressure, and limiting the formation of atherosclerotic plaque. It helps improve the function of the central nervous system by increasing blood flow to the brain and increasing neurotransmitters such as serotonin, dopamine, and acetylcholine, which affects our mood and memory and may help in preventing dementia. It also increases bone formation and muscle building, thus helping to prevent osteoporosis. Estrogen can also help prevent skin dryness, loss of hair, subcutaneous fat and collagen. Next we will review the functions of progesterone. Progesterone helps to balance estrogen, and prevent overgrowth of the uterine lining and breast tissue. It helps protect the nervous system by increasing GABA, a neurotransmitter that helps keep us calmer and sleep deeper. It is a natural diuretic and helps prevent fluid retention and also optimizes estrogen receptors to help estrogen function better. Testosterone helps to increase muscle mass, boost libido, helps with mood, and promotes bone building. Testosterone also helps improve insulin sensitivity and protect the cardiovascular system. Now that we have reviewed the three main sex hormones, let's discuss the top 3 reasons why women seek bioidentical hormone replacement therapy. The first reason is quality of life. Menopausal symptoms that interfere with a woman's quality of life include hot flashes or night sweats, insomnia, fatigue, vaginal dryness or painful intercourse, frequent bladder infection or incontinence, loss of interest and low libido, moodiness, memory loss, mental fog, and weight gain. A lot of women think menopause is only associated with hot flashes, and when the hot flashes stop, menopause is over. The reality is that hot flashes are a warning signal from our body telling us that we need hormones. If we ignore it, the hot flush goes away, often in a year or 2, but all the other symptoms settle in. The second reason women seek bioidentical hormone replacement therapy is for prevention of age-related diseases, such as osteoporosis and dementia. Our body is going through constant remodeling, the old tissue dies off and new tissue is formed. We need estrogen and testosterone to grow new bone, muscles, and brain cells. When we get older, we keep on losing the old bones, but the new bone tissue does not form as efficiently due to lack of hormones. The same applies to brain cell formation. We used to think that we could not generate new brain cells, but now we know this is possible. It is called neuroplasticity. Not only do hormones play a role to generate new brain cells, they also help to increase neurotransmitters such as dopamine and serotonin, which helps with mood, and acetylcholine, which helps with memory. The third reason women seek hormone replacement therapy is to slow down the aging process. When we lose estrogen, we lose subcutaneous fat and collagen, which means our skin begins to wrinkle and sag. When we lose testosterone, we lose muscle mass and we start to gain weight, especially fat in the middle. When we lose progesterone, we don't sleep well and thus become more tired. Hormone replacement is an optional treatment, so it's by choice. If the above reasons are important to you, then you are a candidate for hormone replacement therapy. It makes sense to use bioidentical hormones, because the chemical structures are the same as our own. If you do decide to use bioidentical hormone replacement therapy, the next question is, how do you want those hormones to get into your body? There are 4 available methods of delivery. The first delivery method is transdermal, such as creams, gel or patch. Absorption is not reliable for cream and gel, since it can be rubbed off or sweated off before full absorption is complete. Patches have adhesives which may cause skin irritation to the user. The second delivery method is oral. Oral hormone therapy goes to the liver directly and 90% is excreted. Even using bioidentical hormones, such as estradiol orally, can lead to increased inflammation and blood clots. The third method is sublingual, which involves placing a dissolvable tablet or lozenge under the tongue until it dissolves. This allows the hormone to be absorbed through the buccal mucosa and get into the capillary and the blood circulation directly. The sublingual route of delivery causes a surge of hormones, which diminishes within 12 hours. I use progesterone sublingually at bedtime to help with sleep. The fourth method is the subcutaneous pellet implant. The pellet insertion is a minor surgical procedure, but it is the most physiologically appropriate form of hormone replacement therapy, as it releases the hormone slowly over the course of 4 to 6 months on average. It is as if your own ovaries are functioning again. The advantage of pellet therapy is the convenience it provides. It is very effective, providing a consistent blood level which can help with mood, muscle, and bone growth. With pellet therapy we can also avoid side effects, such as altered lipid panels and coagulation factors, that are often associated with oral estrogen. The following 3 case studies are examples of patients who benefited from pellet therapy. Terry, a 38-year-old female, had a double mastectomy and total hysterectomy in 2020. She had been on estradiol patch and progesterone cream with little to no relief. Her symptoms included occasional hot flashes, severe insomnia, fatigue, moodiness, mental fog, and low libido. She also gained 15 pounds in 1 year. After pellet therapy, all her symptoms improved and she now feels like herself once again. Colleen, a 57-year-old female who had never had any form of hormone replacement therapy. Her symptoms included mild hot flush and insomnia, severe fatigue, extreme moodiness, mental fog, and low libido. She had been treated with antidepressants for her symptoms and antibiotics for frequent bladder infections. After pellet therapy, all her symptoms improved and she was able to gradually wean off the antidepressant. Irene, a 54-year-old female, had a hysterectomy due to fibroid tumors. She had been on estradiol 1 mg orally daily with little to no relief. Her symptoms included a lot of anxiety, a non-existent libido, and weight gain. After pellet therapy, all her symptoms improved. The symptoms described in these case studies are not unusual. Many women have gone from doctor to doctor seeking help, only to be put on antidepressants, sleeping pills, and all kinds of less effective hormone therapies that bring no relief. As previously observed and supported by research, subcutaneously implanted bioidentical hormone therapy is optimally effective and should be offered as a first-line therapy to avoid suffering and deterioration of health. Unfortunately, a good majority of gynecologists are unfamiliar with pellet therapy, and therefore, patients are not offered this option. Now, let's delve into a common question and concern regarding hormone replacement therapy, which is, will this treatment cause or increase my chances of breast cancer? Breast cancer is one of the most common cancers in females, and the older you are, the higher the rate of breast cancer occurrence. 50 years ago, 1 in every 20 women was diagnosed with breast cancer, and now it is about 1 in every 8. Birth control pills and hormone replacement therapy are often named the culprits for this dramatic increase in statistics, but if you consider the rate of prostate cancer in men, 50 years ago it was also 1 in every 20 men who were diagnosed. Now, it is about 1 in every 8, just as with women. But men, unlike women, have not been receiving hormone replacement therapy as routinely as women, which begs the question, what is the explanation for the increase in prostate cancer in men? Part of the explanation is that both sexes are living appreciatively longer, and both cancers increase in frequency with age. Another explanation is that in the last 50 years, preventative screening measures, such as mammograms and PSA lab tests, have become routine, which will also increase the number of cancers found. A third reason, and one which I truly believe is likely the biggest factor, are environmental toxins, especially xenohormones, which are chemicals that can mimic the effect of estrogen and cause DNA mutations. There are several ways to reduce cancer of all kinds, and I will review the 5 simple suggestions I routinely share with my patients. Number 1 is to reduce your toxin exposure. Avoid xenohormones such as pesticides, plasticizers, and other industrial compounds. Number 2. Improve detoxification by eating a diet high in cruciferous vegetables, drinking lots of filtered water, avoiding constipation, and exercise to sweat. Number 3. Improve immunity by practicing stress reduction, make sleep a priority, exercise regularly, and focus on a diet that reduces inflammation. Number 4. Taking supplements such as Inflam Detox, vitamin D, Super Mega Fish Oil, and taking probiotics. Number 5. Achieving hormonal balance can help protect the breast cells. Optimize good hormones such as melatonin, DHEA, and thyroid hormones. Balance estrogen, with testosterone and progesterone if needed. And reduce harmful hormones such as insulin and cortisol. These methods will not only help protect us from breast cancer, they also reduce estrogen dominance-related conditions such as fibrocystic breast disease, premenstrual tension, heavy menstrual bleeding, and fibroid tumors. Bioidentical hormone replacement, if done right, does not increase the risk of breast cancer. Subcutaneously implanted hormones in the pellet form is the most physiological route of delivery, and they achieve the best results in terms of minimizing menopausal symptoms. It is important to replace and balance deficient sex hormones because the benefits go beyond reducing menopausal symptoms. Proper hormone balance can help reduce age-related diseases and can slow down the aging process. Hormone replacement therapy has to be individualized and monitored to achieve the best results and to reduce or eliminate side effects. Testosterone deficiency in women is a neglected problem that can occur even in young women. Adrenal fatigue is very common. Menopause can make adrenal fatigue worse, and vice versa. Thyroid, adrenal, and sex hormones are closely interrelated. Replacing one can affect the others. With hormone replacement therapy, we need to pay attention to all the hormones, especially the major players of the sex, adrenals, and thyroid hormones. They must all be monitored and treated together, as needed, to stay in harmonious balance and optimize optimal health. It is not a given that all menopausal women need bioidentical hormone replacement therapy, but nearly everyone can benefit from it. The misconception is that if your hot flashes are gone, a woman is finished with menopause, whereas in truth, starting menopause is the first step towards aging and dying. The problem is that degenerative diseases such as osteoporosis, memory loss, atherosclerosis, fatigue, decreased immunity, and arthritis do not come all at once. They progress gradually and often imperceptibly until their presence is too painful or obvious to ignore. Keeping sex hormones in the younger age range, combined with a healthy lifestyle, can slow down or prevent these aging-related diseases. If you feel like you are struggling with menopausal or hormonal imbalance symptoms, it is good to know there are natural options for balancing your hormones. My mission is to help men and women not only add years to their life, but to reach optimal health and improve their quality of life. If you liked this video, please like and share it with your friends and family, and don't forget to check out our website for more information.